See, failing dentition, chronic periodontitis. So I have just we have seen these cases and discussed with the pulsar on the cup of tea. He said what to do with it. In a single maxillary mandibular pterygoid zygomatic, finished. Other case, finished. Other case, finished. Finished. This is a segment case. This case has been rejected by many people, but we have done this case. This is a segment case, implant and the prosthesis. See, there is no bone, but we know there is not bone. Placed it. This is Gorsar's case. Double pterygoid. He was placing that time double pterygoid. Now he is going for a triple pterygoid, I think. So always there is a bone. You know how to deal with that available bone. What are the options available? This is the final prosthesis given to the patient. This is my case. Single two premolars are missing. Now you can see I have engaged the cortical bone on the other side and given a prosthesis. That is a prosthesis, second premolar, first quadrant. And this is a follow-up patient when the patient has came after a long time. This is another case. You can see the bone is filling into the extraction socket. The first one is this is the post-op, and this is the time of surgery I have done. Place the extraction socket mein implant I have placed, make a prosthesis, and it is after 6 months. The bone is filling. This is one of the case which also has been rejected by many people. In a CBCT you see there is no bone, only this part is there, but it is enough bone for me. So I have placed the implant, single piece implant with a different angulation and restored the case at the same bone. Patient is not able to believe that he is getting a tooth in a single day. Another patient which I have done few implants, patient like those system because I have restored within the 2-3 days. Later on patient has gone for the full mount case. Another patient we have done an alveolar implant, wait for 6 months, patient बोले नीता मैम के पापा आएंगे तो उनका बोले कि नहीं ये सब सर कुछ और कोई तरीका, मैंने यस फिनिश्ड. अब इसमें देखिए हम लोगों ने healing period में one implant we have also lost in mandibular healing में because we have given nothing. He is using denture and denture is going to load the implant. So patient नहीं चाहता वो चीजें. So we have done the upper. वो भी मेरे ख्याल से 4-5 साल हो गए मुझे इनको कराए हुए. Follow-up में आए थे वो भी patient. This is another case. So the purpose of showing you these cases that these cases are normally we think these are, yes, you might not be knowing the way of treating these patients. This patient is lady of manageable age. She is coming to the department. I am seeing here, but there is no miracle. There is only science, methodology, concepts. You have to deal with those concepts. This is one of the patients with 2-3 years back we have done. This is a follow-up OPG. First one is at the time of placement we have done. Can you see this acrylic prosthesis is worn out in this case? After 2 years we have done in this case. So the acrylic prosthesis is worn out. After 2-3 years you can just change the prosthesis by cutting that prosthesis. And that is very simple. You can use a Diatec burrs. These are very nice burrs. You can use it and then cut it and replace it. This is more than 4.5 years. We have done a conventional implant. The implant has fractured because the high masticatory loads. Those implants we cannot able to take it out. So sir has just bypassed those implants, if you can see, and then we have restored it. This is a follow-up OPG. The prosthesis has been dislodged. So this is the clinical picture. This is the prosthesis. Afterward, जब patient को निकल गई तभी आए, उसके पहले नहीं आए थे. तो इसी prosthesis को ही लगवाना था उनको. That's why I have taken a picture. The patient is satisfied with this prosthesis. I have just modified some occlusal context and just re-cemented the prosthesis. This is the anterior surface. Patient is happy. This patient also single implant. That later incisor I have placed is is the temporary prosthesis, this is the implant, and the final prosthesis. So we can also achieve a good aesthetic if you are able to place the implant in a correct way or manner. Somebody says, अगर किसी को बहुत इच्छा करती है, मन करता है कि हर 6 महीने प्रोस्टेट खोलूंगा, साफ करूंगा, just use this cortical implant principles with the 2-piece prosthesis. These are these single piece implant inserted. This is Dr. Anita Galadoshi's Bombay case, and Godsa has operated these cases. So this is a multi-unit BCS. This is the impression caps, splinted with the pattern resin as the normal prosthesis, as the normal implant, and this is the metal ceramic restoration which is provided to the patient. This is nerve bypass. If you can see onto the posterior side, it is not going into the nerve, it is just going onto the lingual side. The nerve is lying here. So lingual bypass are always easy for the prosthetic point of view. These are the screw channels. You can just unscrew them, and then segment cases also. Just place the pterygoid implant, do the canine bypass. There is enough bone just palatal to the canine root. We can do a canine bypass and restore this case. This is a screw in prosthesis. So no one should die with their teeth sitting in a glass of water, what the brain mark says. But with the basal implant, you can treat any cases. Either it's a, in detail, physically we will see in the hands-on session, but these are very compression screws. A is the compression screw, B is the bicortical screw, and the compression with bicortical screw, or a 2-piece implant that is known as HC2 implant. It's a HC2 implant is like a normal alveolar implant, but if you see this implant design, there is a smooth apex. There is a smooth apex. This smooth apex engages the nasal floor or your lingual area, lingual shelf area, or sinus floor. You can just perforate it, the smooth surface go over there. So we have done a lot of cases with these HC2 implant also, some studies with the HC2 implants. This is bicortical screws. This is ECX, EX. Always it's a smooth surface we use in extraction socket cases. EX means extraction socket. BCS MU, MU means the multi-unit last case we have shown you, that is a MU case where you can use as a normal implant. You can bend them. Also you have a various angulation of the abutments. This is compression screw. KOC means compression micro. This is the compressive implant which I have used in the previous slide of that 1-minute surgery. I have used this OS micro, placed it, single piece, place it, restore it. This is compressive MU. This is HC2 implant with the multi-unit abutment. So take home message is, whenever the bone is available, use normal compressive implant. If your deficient bone is there, you can use bicortical implant to engage the basal bone. These are the various indications of these implants. Because always the bone is available, use that bone, compressive. If the bone is not there, you can use basal bone. But it is good always when you involve both the things. So in the end, I just want to, whenever I see this video, I